Hey Internet, today is June 6th, 2013, and I am 2 days post-op. And being able to say that is really kind of amazing. Um, but I thought I would make this video on my experience and just give kind of a, maybe not an exact play-by-play, but a good picture of what happens when you get to the surgery center and on the day of surgery, because reading blogs about that really helped me, I think, manage my anxiety. And so I had shockingly a very small amount. I'm still really surprised at how calm I was the entire time. Also, I'm not actually this pale. I think it's just a light, um, just for the record. But anyway, I'm going to try and make this not, a super, super long video, but I do want to try and give a good picture of what happens on surgery day. For those of you that are interested. Um, yeah, and at the end, maybe I will show off my bandages, possibly. Anyway, so I was scheduled for surgery at 12:30 in the afternoon. I'm supposed to get there at 10:30 in the morning. The early morning usually are like more complicated cases for guys who are getting man sculpture. They go first. Um, And so since I was just getting top surgery, I was later in the day. So I got there around 10:20, 10:25, something like that, and signed in. And the lady at the desk was really nice. We had a conversation about my first name because apparently she has a grandson who hasn't been born yet, but her granddaughter has proclaimed that he will have the same first name that I do. Um, just coincidentally, she doesn't actually know me, and yeah. But anyway, so we had a chat about that. And then I went and sat down with my family because I have a number of people who were here with me who wanted to, help me through this basically, which is really nice of them. So I have a pretty good support system going. Um, there we go. That's a little better. So did that, and then I got called into the back to do some paperwork. It's payment stuff for the hospital or the surgery center itself, because you pay Dr. Garamoni in his office at least 3 weeks or a month. I'm not sure. It varies on like what you're reading prior to the surgery. So that's taken care of already. But on the day of surgery, you pay the surgery center, and there's an extra. They allot 90 minutes for the surgery, at least for top surgery. I don't know if it's different if you're getting man sculpture. I would guess, but I don't know for sure. But anyway, if you go over that 90 minutes or if it takes longer, then there's a fee of $200 per every 30 minutes over that you go. So you have to sign stuff for that. Yeah. So then I went back and sat in the waiting room for a while. I guess they were running a little bit behind on that day. And Dr. Garamoni was still in surgery with his first patient, and there was someone ahead of me. So I finally got called into the back around 11:40 or so, and they took my temperature and gave me a wristband and hospital ID badge or band, and made sure that double checked that wasn't allergic to anything, checked my name, my birth date, what procedure I was having done. They'll ask you those things a number of times throughout. Checked allergies, made sure that I don't have anything loose in my mouth, no dentures or crowns or jewelry or anything like that, because they place a tube in your throat during surgery and you don't want to knock anything around that'll come out. But yeah, you also have to give a urine sample, and I was reading through the booklet, and it says that female patients have to give a urine sample before surgery to rule out pregnancy. So I don't know, maybe if you've had a hysterectomy, you wouldn't have to do that. But so they will want that. So if you're going, early in the morning, and then maybe it's better to not pee before that, if you can help it, especially if it's hard for you to go under pressure like it is for me, which is probably more than you needed to know. But anyway, so did that. Then they took me back to the pre-op area where there's, a bunch of beds and curtained off little areas. And they gave me a hospital gown and told me to take everything off except for my boxers and my socks. The reason for the socks being that it gets cold there, and so that'll help keep you warm. Also, I wore socks that were like mid-calf length, that were argyle with mustaches on them, because like you can't pass up mustache print. I mean, come on. And so you do that, and you get in the bed. They give you a bag to put your stuff in, and your shoes go on beneath the gurney, the bed thing. It goes there, and then they let my mom come back and sit with me, because it was going to be a while until I got taken back. And eventually the anesthesiologist came around, and I chatted with him some and went over the same stuff, nothing loose, no allergies, etc. And Dr. Garamoni came by and marked up my chest, because when you lay down, stuff shifts, so he draws, lines to guide his incisions and that kind of stuff, blueprints basically, so that, and he has you, stand up to do that. And you can still kind of see a little bit, this kind of, so that's one of them that I haven't been able to wash off, and there's tape here and bandage. But so he does that, and then there was still a guy ahead of me to get his surgery done, so he was going to go. Dr. Garamoni went to do that after he marked me, so it's still going to be a bit of a wait. And then they came around to put my IV in. They gave me a chance to use the bathroom before getting the IV in, which I would recommend, especially if it's going to be a wait for you. Go then. Even if you don't feel like you need to, just go. Try, because it's a lot easier to do it without the IV than with the IV. It's still doable, but you're kind of, and someone will help you, but you're trying to manage like the IV in one arm and holding your gown closed at the back with your other hand, because you're not supposed to tie it, because they are going to be taking it off, so unless you want to like moon the whole ward. But anyway, so did that, and just a heads up, I'm going to talk about needles a little bit right here, so warning. But they gave me a choice of having the IV in the back of my hand or in my wrist, and I figured since I've had one in my hand before and it was kind of annoying, and I was going to be just sitting there for a while, I'd go with the wrist. So they were kind enough to do that for me, and I mean, it's still uncomfortable. It's still a needle in your arm that's just sitting there, but it wasn't too bad. So yeah. Straws are your friend after surgery. Also, this mug is coming in handy. Sadly, this is just water and not butterbeer, but anyway. Right. So, okay, we're already at 9 minutes. Well, anyway, so they placed the IV, and I was waiting for another, I'm not even sure, because I didn't have a clock back there at that point, but they did also, they let my family sort of rotate out, so both, the other family members who were with me got to come back and sit with me for a while before I went into surgery, so I got to see everyone. And then the surgical nurse and an intern came by to take me back, and they checked my ID band and asked me same kinds of questions again, and took me back. And I remember going into the OR and being moved from the gurney onto the operating table, and they put a mask over your mouth, and they put something in your IV. Well, actually, they put something in my IV as we were going in, but it didn't really seem to quite hit that soon, because I do actually remember being switched on the operating table, I think. And then I was out. And when I woke up, I was in the recovery room. This time, and when I had my wisdom teeth out and I woke up from the anesthesia, I was, I've been pretty mentally sound, pretty much upon waking, at least in my opinion, I think. I don't know, I remember everything. So, yeah, I was originally in or still lying on the bed. Um, and I still had my socks, but my boxer briefs were not on. But one of the first things that they do is help you to put those back on. So that I appreciated. And they gave me an injection in my arm that they said was for both pain and nausea. I was in some pain when I woke up, but it wasn't that bad. It was kind of like a burning along where I imagine the incision sites are, and it was like a 4.5 out of 10. Not too bad. So that was all right. I wasn't able to speak right as soon as I woke up, because one, I was still kind of gaining control of my body, basically, and two, because my throat was sore because they do place that tube. Um, but the soreness didn't last that long. I was fine pretty much by the next day. But yeah. So, as you come to more, they will move you from the bed to a recliner, and then, have you drink some water. They'll offer you water or juice, or I can't remember if ginger ale was on the list. But, have you drink something. Your family gets to come back and see you. They have you use the bathroom before they release you, and they'll help you put on your clothing and that kind of stuff, and help you out to the car, which I was surprised that they didn't have me sit in a wheelchair to go out. I just got to walk out, which was fine, and show you how to put on your seatbelt, because you still have to wear your seatbelt, but you don't want it like right across your chest because that's going to hurt. So you put the cross piece actually goes behind you, and you just kind of have the lap belt on. But yeah, and then I came back to the hotel and slept pretty much. Yeah, so that was my experience with that. I hope that was helpful for someone out there. Yeah, so this is a long video.